Hi, my name is Candace Markey. I'm in the MLT to MLS program at University of Kentucky. I'm doing my case study today for my microbiology class. The bacteria I chose to do my case study on is lactobacillus rhamnosus. I chose lactobacillus rhamnosus from an article I found online as I was searching for case studies. I don't work in the microbiology lab right now. I'm more of a generalist, so I don't have a personal experience to go off of. I found this case study interesting because it explained that studies have shown that if you give lactobacillus probiotics to premature babies, it helps prevent diarrhea due to any antibiotics that they're on for infection while still in the hospital. Lactobacillus rhamnosus, though, in more recent studies, have shown to cause sepsis in premature babies. So they have to stop giving the lactobacillus rhamnosus, just that specific species, because it could cause sepsis in premature babies. So my case study today is not on a premature baby, but she has other health issues that are causing her to have to be in the NICU. My case study is on a little baby girl. She was born at 39 weeks, but she only weighed 3.5 pounds. Her APGAR scores were 5 and 8 at 1 and 5 minutes after birth. The highest APGAR score is 10, so 8 really isn't that bad. But she ended up having to stay in the hospital because she has trisomy 18 and triple X syndrome, as long as a few different heart defects. So she was in the NICU being treated for those, helping her to be able to get to go home. And in the meantime, she was caught pneumonia and she was septic. And so she was septic due to Staph aureus. They put her on daptomycin to help clear it up. And she was doing fine until day 97 post birth. She spiked a fever and her heart rate went up. So, of course, they're going to do some lab works. They did labs. Her white blood cell count was 8,040. Her platelet count was 80,000. And her C-reactive protein was 135.3. They also did procalcitonin, and her procalcitonin level was 10.12. So, of course, physicians, they ordered some blood cultures from 2 different sites, sent to microbiology lab. They all grew lactobacillus rhamnosus. So microbiology, they isolated it to get some susceptibilities to give to the physicians. Obviously, the daptomycin did not help that. They ended up discontinuing the daptomycin, and the physicians, once they found out that it was lactobacillus rhamnosus, stated that they had been giving her lactobacillus rhamnosus probiotics twice a day since day 9. So this is day 97, almost 90 days she had been getting lactobacillus rhamnosus, and it caused her to become septic. So they did susceptibilities, and they ended up going with clindamycin. There are several different antibiotics that were susceptible, but that's the one the physicians chose. They had her on clindamycin for 10 days, and she ended up getting better. They went on ahead and they didn't give her any probiotics anymore, and she improved. They helped her other clinical issues, and at day 300, she was able to be discharged from the hospital and go home. Of course, there were certain things that the parents had to do to help her live comfortably, to help with the heart defects and respiratory issues she had. So she was able to go home, but that is just one of the case studies out of several that show that lactobacillus rhamnosus can cause sepsis in premature babies if given. Lactobacillus rhamnosus for healthy individuals is not harmful. It's not just going to randomly cause you to become septic because you ate something with lactobacillus rhamnosus. That's lactobacillus rhamnosus is actually a part of your natural gut flora. They also add it to certain dairy products such as milk, cheese, yogurt, along with other lactobacillus species as well. Lactobacillus rhamnosus. There's certain things that has been proven to help, like it is proven to help the diarrhea if you're on certain antibiotics. It could help with IBS. And as I was doing my research, I found that it could help with cavities in your mouth, which is crazy to me, but it said that the bacteria that eats away your acid on your teeth, causing the cavities, the lactobacillus rhamnosus, can fight it and can actually prevent the cavities that way. So it said for children you could give it to children to help prevent cavities. It could also help prevent UTIs. It has actually many benefits to eating the lactobacillus rhamnosus in certain dairy products or just taking probiotic supplements. Lactobacillus rhamnosus is just not to be given to premature babies. Thank you.